There's a popular image of space travel that movies love to show us. Astronauts floating gracefully through pristine white corridors, gazing at Earth through panoramic windows, their biggest worry apparently what freeze-dried meal to have for dinner. It's beautiful, it's inspiring, and it's completely wrong about what deep space actually does to the human body. The truth is far more unsettling. Beyond Earth's protective embrace, space doesn't just challenge human survival, it systematically dismantles it. Every system in your body, every cell, every molecule faces threats that evolution never prepared us for. Because here's what most people don't realize. We've never actually sent humans into deep space. The moon, that's barely leaving the front porch, the International Space Station, still tucked safely within Earth's magnetic shield. Mars represents something entirely different, a journey into an environment so hostile that surviving it requires overcoming problems we're only beginning to understand. And some of those problems might not have solutions at all. If you find comfort in these gentle explorations of space and science, I'd be grateful if you'd consider subscribing and giving this video a like. Let's start with something you can't see, can't feel, and can't hide from. Radiation in deep space isn't like the X-rays at your dentist's office, or even the elevated exposure you get on a cross-country flight. It's a relentless bombardment of particles moving at near light speed, born in the violent deaths of stars billions of miles away. These cosmic rays tear through spacecraft hulls like they're not even there, then tear through human tissue with equal ease. The numbers are staggering. Astronauts on the International Space Station receive about 72 millisieverts of radiation during a 6-month mission. Concerning, certainly, but manageable. A 3-year mission to Mars. Over 1,000 millisieverts. To put that in perspective, NASA estimated in 2017 that such a journey would expose astronauts to the equivalent of 3,600 chest X-rays. Not spread out over a lifetime, concentrated into 3 years. But raw numbers don't capture what's actually happening at the cellular level. Galactic cosmic radiation consists of particles so energetic, so heavily charged, that they don't just damage DNA, they shred it. When these particles slam into living tissue, they create what scientists call free radical cascades, chains of chemical reactions that spread damage far beyond the initial impact point. Your cells have repair mechanisms for normal DNA damage, the kind that happens naturally every day. They're completely overwhelmed by this. Here's where it gets worse. Conventional shielding doesn't work. You might think, just add more metal to the spacecraft walls. Except when these high-energy particles hit heavy atoms in shielding material, they splinter them, creating showers of secondary radiation. In some cases, thick shielding actually increases the radiation dose inside the spacecraft. It's like trying to stop bullets with a wall that turns each bullet into 20 smaller bullets. The biological consequences read like a medical horror story. Increased cancer risk, obviously, but that's almost the least of it. Studies show cosmic radiation causes cardiovascular damage, accelerates aging, triggers cataracts, and attacks the central nervous system in ways we're only beginning to understand. Animal studies have revealed something particularly disturbing. Exposure to the type of radiation found in deep space permanently alters brain structure. Researchers exposed mice to 6 months of neutron radiation meant to simulate a Mars journey. The results showed changes in brain function that would translate directly to humans. Specifically, severe impairment in the ability to respond to stress or unexpected situations. Think about that. You're on a spacecraft 140 million miles from Earth when a critical system fails. You need to think clearly, act decisively, troubleshoot problems you've never encountered before. But your brain, damaged by months of radiation exposure, can't process information the way it used to. The study's conclusion was even more chilling. In a crew of 5 astronauts traveling to Mars and back, at least one would likely display severe cognitive deficits by the time they returned to Earth. Not might display, would display. The radiation damage isn't a risk you can mitigate with training or preparation. It's a certainty you can only hope to minimize. And cosmic radiation isn't even the worst part. At least it's constant, predictable in its unpredictability. Solar particle events are different, sudden eruptions from the sun that can spike radiation levels to lethal doses in a matter of hours. These events occur without much warning, following the sun's 11-year cycle, but impossible to predict with precision. During a solar storm, radiation levels can jump so high that without proper shielding, astronauts could experience acute radiation syndrome, nausea, hemorrhaging, possibly death. On the International Space Station, astronauts can retreat to more heavily shielded areas during solar storms. On a Mars-bound spacecraft, there's nowhere to hide. The ship has to carry everything it needs for 3 years, which means every kilogram counts. Thick radiation shelters aren't just heavy, they're prohibitively heavy. Engineers face an impossible balance. Enough shielding to protect the crew versus enough fuel, food, water, and equipment to keep them alive. But let's say we solve the radiation problem. Let's imagine some breakthrough in materials science gives us lightweight, effective shielding. We still face something equally insidious, something that happens the moment you leave Earth's gravity behind. Your body is betraying you. Microgravity doesn't just make things float. It fundamentally rewrites human physiology in ways that become catastrophic over extended periods. Within weeks of entering zero gravity, astronauts begin losing bone mass at a rate of 1 to 2% per month. Read that again, per month. By comparison, elderly people on Earth lose bone mass at about 1% per year. In space, you're aging your skeleton at 12 to 24 times the normal rate. The muscle loss is equally severe. Astronauts can lose 10 to 20% of their lean muscle mass within weeks. Even with rigorous daily exercise, and ISS astronauts exercise for hours every day, the deterioration continues. One study predicted that a Mars mission would result in a 15% loss of lean body mass. That's not just about looking less fit. That's about whether you can perform physically demanding tasks, whether you can handle an emergency, whether you can even walk when you finally reach Mars with its partial gravity. Your cardiovascular system undergoes its own transformation. On Earth, your heart works against gravity to pump blood upward to your brain. In microgravity, it doesn't need to work as hard. Sounds nice, except your heart is a muscle, and like all muscles in space, it weakens. Blood vessels stiffen. Fluid distribution throughout your body changes, shifting toward your head in ways that create their own cascade of problems. About 70% of astronauts on the ISS experience swelling at the back of their eyes, a condition called spaceflight associated neuroocular syndrome. The shift of fluids toward the head increases pressure on the optic nerve, flattens the eyeball, creates folds in the retina. Some astronauts have experienced permanent vision changes, Most concerning, we don't know what happens during a multi-year mission. The condition might worsen progressively, potentially leading to permanent vision loss. Imagine trying to pilot a spacecraft or conduct critical repairs while your vision deteriorates with no way to fix it. Then there's your immune system. Microgravity weakens it in ways that scientists are still mapping out. Studies have found that T cells, the crucial warriors of your immune response, show significantly reduced function in zero gravity. The genes that regulate immune response get down-regulated, meaning your cells literally become less capable of fighting infection. Meanwhile, bacteria become more virulent in space, more resistant to antibiotics, more dangerous. Here's the nightmare scenario. You're 18 months into a Mars mission, your immune system has been steadily weakening, and you develop what would normally be a minor infection. But there's no hospital, no possibility of evacuation. The antibiotics you have might not work against the space-adapted bacteria. More than half of Apollo astronauts experienced infections during their missions, and those only lasted days. During the Space Shuttle era, 106 infectious disease incidents were reported across just 29 missions. Now extend that to 3 years, in a confined space, with a weakened immune system, and bacteria that are evolving to become more dangerous. Even NASA acknowledges that up to 50% of astronauts returning from space missions show compromised immune systems. That's not an acceptable risk when you're 140 million miles from the nearest emergency room. But wait, there's more. And somehow it gets worse. Because we haven't even discussed what happens inside your skull. Recent research has revealed that cosmic radiation doesn't just damage brain tissue, it fundamentally alters how neurons communicate. Studies on mice exposed to radiation equivalent to a Mars journey showed that the circuits connecting neurons could no longer communicate efficiently. Some neural pathways appeared completely broken. The behavioral effects were profound. The irradiated mice showed impaired decision-making, reduced ability to respond to novel situations, and decreased capacity to handle stress. Translate that to human astronauts and you're looking at people who might make critical errors in judgment, who might freeze during emergencies, who might not be able to adapt when things go wrong. And things always go wrong in space. One researcher put it bluntly, in a crew of 5 traveling to Mars and back, expect at least one member to display severe cognitive deficits by return. Not possible deficits, expect them. The radiation damage to the brain isn't something you might avoid with luck. It's something you're guaranteed to experience to some degree. The psychological challenges compound everything else. Future Mars missions will require crews to live in a space roughly the size of a studio apartment for 3 years, with the same few people, with communication delays of up to 44 minutes round trip to Earth, with the knowledge that if something goes catastrophically wrong, no rescue is possible. Earth becomes an insignificant blue-green dot, then disappears entirely from view. The isolation is called the Earth out of view phenomenon, and we have no idea how humans will psychologically handle it. Studies of isolated environments on Earth, Antarctic research stations, submarine deployments, consistently show that the stress isn't about dramatic events. It's about the relentless, grinding constancy of the hostile environment. Day after day, month after month, year after year. No escape, no privacy, no moment when you're not acutely aware that a thin metal shell, is the only thing between you and instant death. Military psychiatry and space medicine agree on this. Environments don't have to be catastrophic to be psychologically erosive. They just have to be relentless. And deep space is nothing if not relentless. The synergistic effects might be the most terrifying aspect of all. Each hazard doesn't exist in isolation. They amplify each other. Radiation weakens your immune system, while microgravity is also weakening your immune system. Your deteriorating cardiovascular system struggles more because radiation is damaging your heart and blood vessels. Your bones are becoming brittle from microgravity, just as radiation is interfering with your body's repair mechanisms. Your brain is being damaged by cosmic rays, while psychological stress is impairing your cognitive function. It's not 5 separate problems. It's 5 problems that multiply each other's effects, creating a cascade of health deterioration that accelerates the longer you remain in deep space. NASA acknowledges these 5 hazards: radiation, isolation and confinement, distance from Earth, gravity or lack thereof, and hostile environments. But what they're still working to fully understand is how these hazards interact, how they compound, how they create health problems that wouldn't exist if each hazard were experienced in isolation. And here's what should really keep you awake at night. We've never tested this. Not really. The longest anyone has stayed in space continuously is just over a year. Valuable data, certainly, but a Mars mission requires 3 years. We're extrapolating, making educated guesses, hoping that the deterioration we see in 12 months doesn't accelerate catastrophically in year 2 or year 3. Some effects might not appear until you're already past the point of no return. Kidney damage, for instance. A 2024 study found that even 1 month in microgravity can permanently alter kidney function. The longer you stay, the worse it gets. Astronauts who spent 6 months in space showed arterial and endocrine damage consistent with over a decade of aging. 6 months aged them 10+ years biologically. What happens in 3 years? Do you age 30 years? 50? Is there a threshold beyond which the damage becomes incompatible with life? We don't know. We can't know without actually sending people on these missions. And that's the fundamental problem lurking beneath everything else. We're conducting an experiment with incomplete data, hoping the human body won't betray us in ways we haven't predicted. The ethical implications are staggering when you actually sit with them. We're talking about sending people into an environment that will damage them in ways we can measure and ways we probably can't. Ways that might not manifest until they're already months into a mission with no possibility of turning back. How do you get informed consent for something when the information itself is fundamentally incomplete? NASA has guidelines for acceptable radiation exposure over an astronaut's career. Those limits exist for a reason. They represent the point where cancer risk becomes unacceptable. A 3-year Mars mission would push astronauts right to that edge, possibly beyond it. We're essentially asking people to accept a significantly elevated lifetime cancer risk as the price of admission. And that's just the radiation we can measure. What about the cognitive effects? The cardiovascular damage? The accelerated aging that might mean returning astronauts are biologically 20 or 30 years older than when they left. The selection process for Mars astronauts is going to be brutal. Not just physically, we're looking for psychological resilience that borders on superhuman. You need people who can handle extreme isolation without breaking down. who can manage interpersonal conflicts in a space the size of a studio apartment with no escape, who can perform complex technical tasks while their cognitive function is potentially declining from radiation damage, who can make life or death decisions with a 44-minute communication delay, making real-time support from Earth impossible. You're essentially looking for people who don't exist. And here's something that doesn't get discussed enough in polite company. Crew composition becomes a minefield of variables we barely understand. Mixed-gender crews introduce complexities around radiation exposure. Women are more susceptible to certain radiation-induced cancers. Younger astronauts might handle the physical demands better, but face longer lifetimes for radiation-induced cancers to develop. Older astronauts might be more psychologically stable, but have less physical resilience. There's no perfect demographic profile because the environment is hostile to all human biology. Then you have the medical autonomy problem that should terrify anyone who thinks about it for more than 5 seconds. On the International Space Station, if something goes seriously wrong medically, you can potentially evacuate someone back to Earth within hours. On a Mars mission, that option doesn't exist. The spacecraft becomes the only hospital available for 3 years. The crew needs to be capable of handling everything from appendicitis to compound fractures to potential cancer diagnoses, with whatever equipment they brought with them. Surgery in microgravity is a nightmare scenario. Blood doesn't pool, it forms floating spheres. Keeping a surgical field clear requires completely different techniques. Anesthesia behaves differently when fluids don't settle. We've practiced some of this in parabolic flights and simulations, but we've never had to perform emergency surgery during an actual long-duration spaceflight. The first time it happens will be terrifying. And what about psychological crises? Depression, anxiety, even psychotic breaks are possibilities during a 3-year mission under extreme stress. The psychological screening is extensive, but it can't predict everything. What happens when someone has a severe mental health crisis millions of miles from any psychiatric facility? The crew becomes the treatment team with limited training and limited options. Sedation might be necessary in extreme cases, but sedating a crew member for weeks or months creates its own cascade of medical problems. The resupply problem compounds everything. On the ISS, regular cargo missions bring fresh supplies, replacement parts, new experiments, even fresh food occasionally. A Mars crew is essentially on their own. Whatever breaks stays broken unless they can fix it with what they have. Whatever runs out stays gone. The self-sufficiency requirements are absolute in a way that's difficult to comprehend. Water recycling has to be near perfect. Food supplies have to last years while remaining nutritious, and we're still not entirely sure how to accomplish that. Radiation degrades nutrients over time. Vitamins break down. By year 3 of the mission, the food might be technically edible, but nutritionally incomplete, leading to deficiencies that further compromise already stressed bodies. Spare parts become a critical concern. You can't bring spares for everything. The mass requirements would be prohibitive. So you're gambling on reliability, hoping that critical systems don't fail in ways you can't repair. Every redundant system adds mass. Every backup component is mass you can't use for other things. The engineering optimization problem is brutal, but let's talk about something even more insidious: the microbiome shifts that happen in closed environments. The collection of bacteria, fungi, and other microorganisms in your body and environment changes dramatically during long-duration spaceflight. On Earth, You're constantly being exposed to new microorganisms from other people, from the environment, from food. In a sealed spacecraft, the microbial diversity crashes. The crew members essentially share the same microbial ecosystem. This matters more than you'd think. Your gut microbiome influences everything from digestion to immune function to mental health. Studies on the ISS have shown concerning changes in astronauts' microbiomes. Potentially harmful organisms can proliferate while beneficial ones decline. The closed environment allows antibiotic-resistant strains to develop and spread through the crew, with no influx of competing organisms to keep them in check. We've seen viral reactivation in astronauts on short missions. Dormant viruses like Epstein-Barr or varicella zoster that most people carry suddenly becoming active again because the immune system is suppressed. Over 50% of Apollo astronauts experienced viral reactivations. On a 3-year Mars mission, these reactivations could become serious medical problems. Shingles in microgravity, while radiation is damaging your nervous system, is a nightmare scenario. And the psychological toll of that viral reactivation shouldn't be underestimated. Imagine dealing with painful lesions or systemic viral symptoms while trying to maintain crew morale and perform mission-critical tasks. The physical suffering compounds the psychological stress, which further suppresses the immune system, creating a vicious cycle. The sleep problem deserves its own discussion. Circadian rhythms go haywire in space. Without natural day-night cycles, without sunrise and sunset, your body's internal clock drifts. The ISS orbits Earth every 90 minutes, 16 sunrises and sunsets every 24 hours. Astronauts report serious sleep problems even with carefully controlled lighting. On a Mars mission, you're dealing with Martian sols that are slightly longer than Earth days. But during the transit, you're in deep space with no natural rhythm at all. Chronic sleep deprivation amplifies every other problem. Cognitive function declines further. Emotional regulation suffers. Physical recovery slows. Immune function drops even more. It's another multiplier effect that makes everything worse. And the pharmaceutical interventions, sleeping pills, stimulants, come with their own problems during long-term use. Side effects accumulate, dependency develops. Eventually, you're managing the medication effects on top of managing the underlying sleep problems. The interpersonal dynamics become crucial in ways that are difficult to simulate. You're living with the same few people in crushing proximity for 3 years. Every annoying habit becomes magnified. Every personality conflict has nowhere to diffuse. Studies of isolated environments consistently show that interpersonal friction is one of the biggest threats to mission success. It's not dramatic, it's the accumulation of small irritations that eventually become unbearable. Crew selection has to account for compatibility in ways we're still learning to assess. Psychological testing can tell you a lot, but it can't predict how people will interact under that specific combination of stresses over that duration. We've had issues on the ISS with crew conflicts, and those missions have regular crew rotations and the knowledge that relief is coming. A Mars crew knows there's no rotation, no early departure option, no escape. The communication delay creates leadership challenges that mission planners are still wrestling with. Every decision can't wait 44 minutes for input from mission control. The crew has to be genuinely autonomous in decision-making. But that autonomy creates stress. The weight of knowing that your choices could doom the entire mission with no one to consult, no backup opinion available in real time. The commander of a Mars mission carries a psychological burden that's difficult to comprehend. What happens when you make a call that turns out to be wrong? When someone gets hurt or dies because of a decision you made with incomplete information and no time to consult Earth? The psychological aftermath of that kind of responsibility, in isolation, with no counseling support available for months, could be devastating. And yet, the mission continues. You still have to function, still have to lead. The return journey might actually be worse than the outbound trip. You're returning in a body that's been fundamentally damaged by 3 years of abuse. Bones brittle, muscles wasted, cardiovascular system deconditioned, nervous system potentially damaged, immune system compromised, vision possibly permanently affected. And you're facing another 9 to 11 months in microgravity that will make all of it worse. Athletes talk about hitting the wall, that point where the body simply has nothing left. Mars astronauts might hit that wall months before they reach Earth. The final approach could be crewed by people who are barely functional, struggling to perform critical tasks with bodies and minds that are failing. Landing a spacecraft safely requires precision and quick reactions. Can astronauts who've aged decades and suffered cognitive decline from radiation exposure reliably execute those procedures? And then there's re-entry and landing itself. Multiple Gs of acceleration slamming into bodies that haven't experienced significant gravity in years. Cardiovascular systems that struggle to pump blood upward against even Earth gravity suddenly facing several times that force. The risk of stroke, heart attack, or simple orthostatic collapse is substantial. We might successfully bring astronauts back from Mars only to have them die during landing from cardiovascular failure. The immediate post-landing period is equally dangerous. Even ISS astronauts require extensive support after 6 months. They literally can't stand unassisted. Mars astronauts will need months or years of rehabilitation. Some of the damage might be permanent. That biological aging we talked about earlier, it doesn't reverse. The kidney damage doesn't heal. The radiation-induced cancer risk remains elevated for life. We're potentially creating a new category of human, Mars veterans whose bodies have been fundamentally altered by deep space exposure. They'd require specialized medical monitoring for the rest of their lives. Some might never fully recover the bone density or muscle mass they lost. The vision changes might persist. The cognitive effects might be permanent. Society will have to grapple with how we treat these people. Are they heroes we honor? Damaged goods we quietly pension off? Human experiments we study? The ethical questions multiply when you realize we're essentially creating a class of profoundly injured people in the pursuit of exploration. But here's what might be the most unsettling aspect of all this. We're sending people on a mission, knowing that some of them probably won't come back. Not because of accidents or equipment failures, but because their bodies will fail them. The math is brutal and inescapable. NASA's own risk assessments paint a disturbing picture. Current models estimate that out of a crew of 5 astronauts traveling to Mars and back, at least one will experience severe cognitive deficits by the time they return to Earth. 1 in 5. Those aren't acceptable odds for a camping trip, let alone a multi-billion-dollar mission representing humanity's reach into the cosmos. But cognitive decline might be the least of their worries. The radiation exposure alone creates a cancer risk that exceeds acceptable limits. NASA estimates that astronauts on a 3-year Mars mission would receive radiation equivalent to approximately 3,600 chest X-rays. The International Space Station crew gets about 72 millisieverts during a 6-month stay. Mars astronauts, over 1,000 millisieverts, possibly much more depending on solar activity. That level of exposure sits right at the edge, or possibly over the edge, of what's considered acceptable for career limits. And these limits were established based on shorter missions. We don't actually know what happens to human tissue after 3 continuous years of bombardment by galactic cosmic rays. The animal studies suggest nothing good. Mice exposed to 6 months of the type of radiation astronauts would face showed profound changes in brain structure. The dendritic spines that form connections between neurons literally shrank and deformed. Neural circuits that should communicate efficiently simply stopped working properly. Inflammation persisted for over 6 months after exposure ended. Translation to human terms, we're looking at memory problems, difficulty with complex decision-making, impaired ability to respond to stress or unexpected situations. Exactly the capabilities you need most when you're 140 million miles from Earth dealing with life-threatening emergencies. And here's what makes it worse. Radiation damage is cumulative. Every day in deep space adds to the total dose. There's no recovery period, no chance for your body to repair the damage before the next wave of cosmic rays tears through your cells. It's death by 1,000 cuts, except the cuts are happening at the molecular level in your DNA. The cardiovascular system faces a similar assault. Studies on animals show that radiation exposure leads to arterial stiffening, structural damage to heart tissue, and changes in cardiac rhythm. Combined with the microgravity-induced weakening of the cardiovascular system, you're creating the perfect conditions for heart disease. Astronauts who've spent just 6 months on the ISS show arterial and endocrine damage consistent with over a decade of aging. Triple that duration and add massive radiation exposure. We might be looking at people who've biologically aged 30 or 40 years during a 3-year mission. A 35-year-old astronaut could return with the body of a 70-year-old. That's not speculation. That's what the current data suggests. The kidney damage adds another layer of permanent harm. Recent research indicates that even 1 month in microgravity can permanently alter kidney function. Kidneys evolved to work with gravity. They need that downward pull to filter blood properly. Take it away for years and the entire filtration system begins to fail. The 2024 study on this was particularly alarming. Structural changes occurred that didn't reverse after return to gravity. Permanent damage from temporary exposure. Scale that up to a 3-year mission, and you're potentially creating a crew of people who will need dialysis or transplants within years of returning home. Then there's the immune system collapse. More than half of Apollo astronauts developed infections, and those were missions measured in days, not years. The immune dysfunction happens at multiple levels simultaneously. T cells stop responding properly to threats. Cytokine production drops. The inflammatory response that initiates healing gets suppressed. Meanwhile, latent viruses that your immune system normally keeps dormant start reactivating. Herpes, varicella zoster, Epstein-Barr. These viruses live quietly in most people's bodies, held in check by a functioning immune system. Take away that protection, and they come roaring back. NASA reported in 2019 that latent virus reactivation happens during space missions. Astronauts on short shuttle flights, 12 to 16 days, showed reactivation of dormant viral infections. What happens during a 3-year mission with a progressively weakening immune system? Probably nothing good. And you can't simply take antibiotics or antivirals to solve the problem. Medications have limited shelf lives. You can't carry 3 years' worth of every possible drug you might need. The spacecraft's medical supplies are necessarily limited by weight and volume constraints. So when someone develops a serious infection 6 months into the outbound journey, the crew is working with whatever supplies they brought. No resupply missions, no medical evacuation. The doctors on Earth can offer advice via 44-minute round-trip communications, but they can't examine the patient, can't run sophisticated tests, can't intervene directly. The crew's medic has to diagnose and treat based on limited equipment and experience. And that medic is probably also suffering from cognitive decline, vision problems, and physical deterioration. They're trying to practice medicine while their own body is failing. Surgical capability becomes critical in this context. Given the impossibility of evacuating anyone to Earth for medical care, the spacecraft needs to support surgical interventions. But surgery in microgravity presents challenges we've barely begun to address. Blood doesn't flow down, it floats. Surgical instruments drift. The surgeon's hands shake from muscle deterioration. Anesthesia behaves differently in microgravity. Recovery from surgery takes longer when the immune system is compromised and bone healing is impaired. We're essentially asking astronauts to become trauma surgeons, operating in the most hostile environment imaginable, on patients whose bodies have been fundamentally weakened by the journey itself. The vision problems add yet another complication. Approximately 70% of ISS astronauts experience swelling in the optic nerve and changes to eye structure. Spaceflight-associated neuroocular syndrome causes globe flattening, retinal folds, and shifts in vision that can persist for years after return. Most astronauts haven't experienced permanent vision loss yet, but those are 6-month missions. Nobody knows what happens during a multi-year exposure. The manuscript reviewing SAN's clinical manifestations notes that if optic disc edema becomes severe enough, astronauts risk permanent loss of optic nerve tissue and thus permanent loss of visual function. Imagine trying to pilot a spacecraft or conduct repairs when you can't see clearly, when your depth perception is compromised, when reading instruments requires squinting and guessing. The psychological dimension interweaves with all these physical challenges in ways that amplify both. Depression impairs immune function. Anxiety affects decision-making. Isolation combined with physical deterioration creates a feedback loop where each problem makes the others worse. Military psychiatry and space medicine agree on one principle. The environment doesn't have to be catastrophic to be psychologically erosive. It simply has to be relentless. And a Mars mission is nothing if not relentless. 3 years of confinement in a space roughly the size of a studio apartment, with the same 4 or 5 people, eating the same recycled food, breathing the same recycled air, knowing that Earth is an insignificant blue-green dot that's getting smaller every day. Communication delays create profound isolation. ISS astronauts can video call family and get real-time support from psychologists. Mars astronauts face up to 44 minutes round-trip delay in communications. You can't have a conversation. You can't get immediate emotional support. You record a message, wait 22 minutes for it to arrive, then wait another 22 minutes for a response. When you're having a psychological crisis, Waiting 44 minutes for help is an eternity, especially when you know the person on the other end can't actually help beyond offering words. They can't physically be there. They can't extract you from the situation. They can only listen and respond hours later. The research on isolation psychology is unequivocal. The stress level for Mars missions will be substantially higher than anything we've experienced before. The risk of negative mental health effects is not negligible and poses a serious threat to mission success. That's from researchers who specialize in space psychology, not pessimists trying to kill the program. Understanding these behavioral issues and creating effective countermeasures is critical. But how do you counter 3 years of accumulating stress, physical deterioration, and isolation? Exercise helps maintain muscle and bone, but it doesn't reverse radiation damage. Communication with Earth helps psychologically, but it can't eliminate the delay or the distance. Medication might help with depression or anxiety, but those drugs also have limited shelf lives and potential side effects that might be amplified in the space environment. And who monitors medication compliance? Who adjusts dosages when side effects emerge? The crew medic who's also struggling with their own psychological challenges. The compounding nature of these hazards is what makes deep space survival so extraordinarily difficult. Each problem feeds into others, creating cascading failures across multiple body systems simultaneously. Radiation damages the cardiovascular system, which is already weakened by microgravity. The weakened immune system can't fight off infections or repair radiation damage effectively. Vision problems impair the ability to perform repairs or conduct research. Cognitive decline reduces problem-solving ability right when complex decisions become critical. Psychological stress impairs immune function and decision-making. Bone and muscle loss makes physical tasks harder, adding to stress and reducing capability. It's not just that humans face multiple hazards in deep space. It's that these hazards interact synergistically to create levels of damage that exceed what any single hazard could produce alone. NASA identifies 5 primary hazards of human spaceflight: radiation, isolation and confinement, distance from Earth, gravity fields, and hostile closed environments. But these don't exist independently. They form an interconnected web where each hazard amplifies the others. The research data on long-term effects remains disturbingly incomplete. We simply don't know what happens to humans after 3 continuous years in deep space because we've never done it. The longest single spaceflight was Valery Polyakov's 437 days on Mir. Impressive, but less than half a Mars mission duration, and Polyakov was in low Earth orbit, still partially protected by Earth's magnetic field, still close enough for regular resupply, still able to communicate with ground control in real time, still within reach of emergency evacuation if something went catastrophically wrong. Mars astronauts have none of those protections. They're truly on their own in an environment that's actively trying to kill them through mechanisms we don't fully understand, with consequences we can't entirely predict. The ethical implications are staggering. How do you get informed consent when the full extent of the risks remains unknown? We've sent hundreds of people to low Earth orbit. We've kept astronauts on the ISS for months at a time. We have decades of data on what happens to the human body in that protected environment where Earth's magnetic field still provides partial shielding and emergency evacuation remains possible within hours. But deep space is fundamentally different. The radiation exposure alone exceeds anything we've systematically studied in humans. Career exposure limits exist for astronauts. NASA has established maximum allowable doses based on increased cancer risk. Those limits were designed for low Earth orbit missions. A 3-year Mars mission would potentially exceed them by several 100%. We're not talking about slightly pushing the boundaries of established safety protocols. We're discussing exposure levels that NASA's own guidelines classify as unacceptable. The 2017 estimates are stark. 3,600 chest X-rays worth of radiation over the course of a Mars mission. That's not a best-case scenario. That's the baseline expectation, assuming no major solar particle events. If a significant solar storm occurs during transit, astronauts could receive lethal doses within hours unless they retreat to heavily shielded storm shelters. But those shelters add mass to the spacecraft, reducing payload capacity for other critical systems. Every kilogram dedicated to radiation shielding is a kilogram that can't be used for food, water, spare parts, or scientific equipment. The shielding problem reveals a cruel physics paradox. Conventional materials like aluminum or steel provide excellent protection against solar particle events. Those lower energy protons are relatively easy to stop. But galactic cosmic radiation is a different beast entirely. These particles move at near light speed with energies so high they barrel through most materials like they're barely there. Worse, when heavy shielding materials stop these particles, they create secondary radiation showers. The particle fragments into multiple smaller particles, potentially creating more damage than the original cosmic ray would have caused. Some researchers have proposed using water or polyethylene as shielding. Hydrogen-rich materials are theoretically better at stopping cosmic rays without generating as much secondary radiation, but you need meters of water to achieve meaningful protection. The mass requirements become prohibitive. A spacecraft large enough to carry sufficient water shielding would be so massive it couldn't launch with current rocket technology. You're forced to choose between inadequate protection and an unlaunched mission. The kidney research from 2024 added another dimension to the problem. Microgravity doesn't just weaken bones and muscles, it fundamentally disrupts how kidneys filter blood and maintain fluid balance. The study showed permanent alterations to kidney pathways after just 1 month in microgravity. Permanent, not temporary changes that reverse after returning to Earth, but irreversible damage to organ function. Think about what that means for a 3-year mission. Astronauts would spend approximately 18 months in transit with essentially zero gravity. Another 1.5 years on Mars with only 38% of Earth's gravity. That's 2 full years of profound gravitational stress on organs that evolved specifically to function under Earth's gravity. The kidneys aren't designed to process fluids in microgravity. Blood doesn't circulate properly. Waste products don't filter correctly. Calcium leaches from bones into the bloodstream at rates far exceeding what the kidneys can safely process. This creates a cascading failure scenario. Weakened bones release excess calcium. Damaged kidneys can't filter it efficiently. Calcium deposits form in soft tissues. Kidney stones become almost inevitable. But kidney stones in deep space aren't just painful. They're potentially mission-ending emergencies. A kidney stone that blocks the ureter can cause excruciating pain, infection, and potentially fatal complications. On Earth, treatment involves medical imaging, pain management, and sometimes surgical intervention. On Mars, you have limited medical supplies, no CT scanner, and a crew medic who might be dealing with their own health crises. The accelerated aging research is equally disturbing. 6 months in space produces arterial and endocrine damage equivalent to a decade of Earth-based aging. Extrapolate that to 3 years, and you're looking at biological aging of 30 years or more. A 35-year-old astronaut departing for Mars might return with the cardiovascular system of a 65-year-old. Their arteries would be stiffened, their hormone production disrupted, their cellular repair mechanisms compromised. But here's what makes this particularly insidious. Traditional aging happens gradually over decades. The body adapts incrementally to declining function. Accelerated spaceflight aging compresses those changes into months. The cardiovascular system doesn't have time to compensate. Blood pressure regulation fails more catastrophically. Cognitive function declines more sharply. The immune system collapses faster than normal aging would predict, and we're discovering new problems constantly. The blood clotting research from 2019 revealed that astronauts on the ISS developed serious thrombosis issues during 6-month missions. Blood flow became sluggish. Clots formed in veins that should have been moving blood efficiently. These weren't minor clots that dissolve on their own. These were potentially life-threatening blockages that could break loose and cause pulmonary embolisms or strokes. On the ISS, medical evacuation remains possible. A Soyuz capsule can return crew to Earth within hours if necessary. Emergency medical care is hours away, not months. But Mars astronauts would be minimum 9 months from emergency medical facilities during the outbound journey. If a major medical crisis occurs, there's no evacuation option, no air ambulance, no emergency surgery team standing by. Just the crew medic with limited supplies and training, trying to manage conditions that would challenge fully equipped hospitals on Earth. The surgical capability requirement sounds reasonable until you consider the specifics. What kind of surgeries might be necessary? Appendicitis, kidney stones, traumatic injuries from equipment failures, dental emergencies, infections requiring drainage. Each of those procedures demands specific instruments, medications, imaging capabilities, and expertise. A crew medic might have basic surgical training, but they're not an experienced surgeon. They've probably never performed an appendectomy on a conscious patient in microgravity with limited anesthesia and no backup. Medication stability becomes critical on multi-year missions. Most pharmaceuticals have limited shelf lives. Antibiotics degrade over time, becoming less effective or potentially toxic. Pain medications lose potency. Radiation exposure might accelerate drug degradation. Temperature fluctuations in spacecraft storage could compromise medication effectiveness. You can't just pack 3 years' worth of every possible medication because mass and volume constraints are severe, so mission planners must predict what medical emergencies might occur and stock accordingly. But how do you predict the unpredictable? How do you anticipate which crew member might develop which condition? You can screen for pre-existing conditions and select healthy candidates. But healthy people still get infections, injuries, and unexpected illnesses. A hidden genetic predisposition might manifest under space stress. A dormant condition might activate due to radiation exposure or immune suppression. The viral reactivation data is particularly concerning. Latent viruses that lie dormant in healthy people's bodies for years suddenly reactivate during spaceflight. herpes viruses, varicella zoster, Epstein-Barr. These aren't minor nuisances. Shingles outbreaks can be debilitatingly painful. Epstein-Barr reactivation can cause severe fatigue and immune dysfunction. And these reactivations happen during short shuttle missions. What happens during 3 continuous years of immune suppression? 50% of astronauts since Apollo have shown compromised immune function after returning to Earth. Half. Not a small subset with unusual susceptibility, but half of everyone who's flown in space. The immune system is one of the most severely affected systems during spaceflight. That's a direct quote from research literature. One of the most severely affected. Not slightly impacted or moderately influenced. Severely affected. The T-cell research revealed the mechanism. Specific genes that regulate immune response show downregulation in microgravity. The cells simply don't respond to threats the way they should. Pro-inflammatory responses weaken. Cytokine production drops. The entire cellular communication network that coordinates immune defense becomes disrupted. Your body stops recognizing and fighting infections effectively. This immune suppression occurs simultaneously with increased microbial virulence. Bacteria actually become more dangerous in space. The same organisms that cause minor infections on Earth become more aggressive, more resistant to antibiotics, more capable of forming protective biofilms. 106 infectious disease incidents across 29 shuttle missions. That's nearly 4 infections per mission. And those were short-duration flights with healthy, carefully screened astronauts. What's the infection rate going to be on a 3-year Mars mission with declining immune function, reactivating viruses, aggressive bacteria, limited antibiotics, and no possibility of medical evacuation? The research suggests it will be substantially higher. Every crew member will likely experience multiple infections. Some will be minor, others could be severe. A few might be fatal. The autonomy requirement means the crew must handle everything themselves. There's no calling Earth for emergency medical consultation with useful response times. You can send detailed medical data to ground control, but the response arrives 22 minutes later when the patient's condition might have deteriorated significantly. You make decisions with incomplete information, limited resources, and no backup plan. Consider a scenario where a crew member develops acute appendicitis 18 months into the mission. The appendix is inflamed and needs surgical removal. Waiting risks rupture, peritonitis, sepsis, and death. But attempting surgery carries enormous risks too. The crew medic must perform an appendectomy in microgravity, where blood and fluids don't drain properly, where surgical instruments float unless constantly controlled, where the patient can't be properly positioned or stabilized, where contamination risks are higher and sterilization capabilities are limited. They have basic surgical training but limited practical experience. They have some surgical instruments but not a complete operating room. They have general anesthesia but limited monitoring equipment. They have antibiotics but possibly degraded effectiveness. And if something goes wrong during surgery, if bleeding can't be controlled or complications develop, there's no backup surgeon, no emergency transfusion capability, no intensive care unit. The psychological burden of that responsibility is crushing. The crew medic knows they're the only medical resource for 6 people over 3 years. They know their decisions determine whether crew members live or die. They know their surgical skills might be inadequate for the emergencies they'll face. And they're also experiencing the same radiation damage, bone loss, muscle atrophy, immune suppression, and psychological stress as everyone else. They're trying to maintain peak performance while their own body and mind deteriorate. The privacy research highlights another underappreciated challenge. Future deep space crews will live in spaces roughly the size of studio apartments for years. 6 people in permanent close quarters with minimal privacy, no personal space, no solitude, no escape from interpersonal tensions. Every annoying habit becomes magnified. Every personality conflict becomes potentially mission-threatening. Maximizing privacy in minimal space is nearly impossible. You can create small private sleeping quarters, but they're tiny. Most time is spent in shared areas. You hear everything. You see everything. You smell everything. There's no taking a walk to clear your head. No going to another room when someone's irritating you. Just constant, relentless proximity to the same 5 people day after day after day. The Earth out of view phenomenon adds another psychological layer. As the spacecraft travels farther from Earth, our planet becomes less visible until it's just another star in the sky. That visceral reminder of home disappears. The psychological anchor to Earth, to humanity, to everything familiar becomes an intellectual abstraction rather than a visual reality. Some astronauts describe this as profoundly disorienting. Others report feelings of existential isolation. Communication bandwidth limitations mean you can't just video call home whenever you want. Data transmission rates to Mars are severely constrained. You might get short video messages from family occasionally, but real-time conversation is impossible. Written messages arrive hours after being sent. The emotional support that sustained ISS astronauts through difficult moments simply isn't available with the same immediacy or richness. 62% of human decision-making relies on non-verbal cues, facial expressions, body language, tone of voice. A 44-minute communication delay strips away all of that. You're reading text or watching recorded video that's hours old, trying to interpret emotional states from asynchronous messages. Misunderstandings multiply. Relationship tensions increase. The psychological support network that humans evolved to rely on becomes threadbare. The stress multiplies through what NASA calls mission drift. In the first months, everyone's motivated, fresh, eager to prove themselves. They follow procedures meticulously, exercise regularly, maintain sleep schedules. But 6 months in, something shifts. The novelty wears off. The mission that seemed like an adventure becomes a grinding endurance test. Procedures that seemed important start feeling pointless. Why does it matter if you log your food intake exactly? Why maintain that strict sleep schedule when you're not tired? Mission drift is subtle at first. Someone skips one exercise session. Another crew member postpones a routine maintenance task. Small deviations that seem harmless. But in isolated environments, small deviations compound. One person's relaxed attitude influences others. Group norms shift. Before long, critical safety protocols are being ignored or modified. And the communication delay means mission control can't catch these problems in real time. By the time someone on Earth notices concerning patterns in the data, weeks have passed. The corrective guidance they send arrives days later. The crew might acknowledge it, but resent the interference. They're the ones living this reality. What do people 70 million miles away know about what's actually needed here? This tension between crew autonomy and ground control is well documented in isolation research. The farther crews get from Earth, the more they develop their own culture and decision-making patterns that diverge from mission planners' expectations. Consider what happens when equipment fails, not if, when complex systems break. On the ISS, broken equipment gets replaced during resupply missions every few months. Critical failures can be addressed within days. On a Mars mission, there are no resupply missions, no replacement parts arriving from Earth. You have what you launched with, plus whatever you can manufacture or improvise. The spacecraft carries spare parts, but only for anticipated failures. What about the unanticipated ones? 3D printing technology helps but has severe limitations. You can print plastic components, maybe some metal parts if you have the right equipment. You can't print complex electronics, can't print precision optics, can't print the specialized materials that make life support systems work. When something truly critical fails, something you don't have spares for, the crew faces a problem that could end the mission or their lives. The psychological impact of equipment failures is devastating. Each breakdown erodes confidence in the systems keeping you alive. You start wondering what else might fail. What other single point of failure could kill everyone? The paranoia becomes corrosive. Some crew members might obsessively check systems, burning time and mental energy on excessive monitoring. Others might develop fatalistic attitudes, disengaging from maintenance because what's the point? Water recycling systems illustrate the problem perfectly. The ISS recycles about 93% of water. Urine gets processed into drinking water. Humidity gets captured and purified. Wastewater gets cleaned and reused. These systems are complex, with multiple filtration stages, chemical treatments, and biological processing. They require regular maintenance, frequent repairs, and occasional complete overhauls. On the ISS, when recycling systems fail, fresh water can be delivered within months. On a Mars mission, water recycling failure means rationing the stored supply while desperately trying to repair the system. If repairs fail, the mission ends. You turn around immediately, or you die of dehydration. The same applies to oxygen generation. The ISS uses electrolysis to split water into hydrogen and oxygen. The oxygen gets added to the cabin atmosphere. The hydrogen gets vented or combined with carbon dioxide to make more water. This system breaks regularly. Components wear out, membranes degrade, pumps fail. Again, the ISS gets replacement parts. Mars crews don't. They have chemical oxygen generators as backups, but those consume limited resources. If primary oxygen generation fails permanently, you're measuring crew survival in days. Food presents yet another compounding challenge. Astronauts need roughly 2,000 calories daily. For a crew of 6 over 3 years, that's about 13 million calories. Current space food has a shelf life of around 2 years. Some items degrade faster. Vitamins break down. Packaging fails. Freeze-dried foods absorb moisture and spoil. By mission end, significant portions of the food supply will be degraded or inedible. Growing supplemental food helps, but doesn't solve the problem. Even optimistic projections suggest Mars crews might grow 10 to 20% of their caloric needs. The rest comes from stored supplies that are slowly degrading. Nutritional deficiencies develop gradually. Vitamin C degrades first, then B vitamins. Mineral content in food remains stable, but the caloric density might decrease as fats oxidize. Crew members start experiencing fatigue, weakened immune function, slower wound healing. These effects layer on top of radiation damage, bone loss, muscle atrophy, and psychological stress. The human body has remarkable resilience, but it's not infinite. Every system has breaking points. Now factor in the cargo mass constraints. Every kilogram launched to Mars costs thousands of dollars. Mission planners must balance redundancy against weight. Do you bring 3 spare water pumps or 2? Do you pack extra food or extra medical supplies? Every decision involves calculated risks. What failures can you recover from? Which ones are mission-ending no matter what? The optimization problem is brutal. Under-provision and people die. Over-provision and the mission becomes economically infeasible or physically impossible to launch. The psychological research on isolation consistently shows that around 18 months, crews hit a wall. The initial excitement is long gone. The halfway point brings existential dread rather than relief because you're equally far from both departure and return. This is when interpersonal conflicts intensify, when depression rates spike, when cognitive performance degrades. And unlike Antarctic research stations where psychological crises can result in evacuation within days, Mars crews have no evacuation option. They're committed for the full duration, regardless of mental health deterioration. Sleep disruption amplifies everything. Humans evolved with 24-hour circadian rhythms synchronized to Earth's day-night cycle. Mars has a 24.6-hour day. That extra 40 minutes sounds trivial, but it creates persistent circadian desynchronization. Your body never fully adapts. Sleep quality degrades. Fatigue accumulates. Cognitive function declines. And poor sleep makes radiation damage worse, slows healing, weakens immune response, and exacerbates psychological problems. It's another multiplier in the cascade of degradation. Medication stability becomes critical for mental health. Antidepressants, anti-anxiety medications, sleep aids. These pharmaceuticals degrade over time, especially under radiation exposure. The active compounds break down. Effectiveness diminishes. By year 3, psychiatric medications might be significantly less potent than when packed. A crew member whose depression was manageable with medication might find their symptoms returning as the drugs lose efficacy. And there's no pharmacy resupply, no option to adjust dosages or switch medications. You're managing mental health crises with a steadily depleting and degrading medical kit. The environmental control systems face relentless challenges. Carbon dioxide scrubbers must remove CO2 that 6 breathing humans constantly produce. If CO2 levels rise even slightly above normal, cognitive function drops, decision-making suffers, reaction time slows, higher levels cause headaches, dizziness, and eventually unconsciousness. The scrubbers use chemical processes that consume expendable resources. Lithium hydroxide canisters on early spacecraft. More advanced systems use regenerable materials, but these wear out. Filter media degrades. Catalyst beds become contaminated. You can clean and regenerate them, but only so many times before replacement is necessary. Temperature regulation presents similar ongoing battles. Spacecraft generate heat from electronics, life support systems, and human bodies. In the vacuum of space, that heat can't convect away. It must be radiated into space using external radiators. These radiators have fluid loops that circulate coolant, pumps that can fail, valves that can stick. radiator panels that can be damaged by micrometeorites. If cooling systems fail, internal temperatures rise. Electronics overheat and shut down. Humans become heat-stressed. In extreme cases, the crew must power down non-essential systems and huddle in the coolest section of the spacecraft while making emergency repairs. Humidity control matters more than most people realize. Too much humidity and condensation forms on surfaces, creating mold growth and corroding electronics. Too little and crew members develop respiratory problems, dry skin, and increased static electricity that can damage sensitive equipment. The systems that balance humidity, condensing water from the air, distributing it evenly, preventing cold spots where condensation occurs, require constant monitoring and frequent maintenance. In microgravity, water doesn't drain. It forms floating droplets or clings to surfaces in unpredictable ways. Managing water in a spacecraft is an endless engineering challenge. Fire suppression systems must be ready, but hopefully never used. Fire in a spacecraft is catastrophic. In microgravity, flames don't rise. They form spheres that can spread in all directions. Smoke doesn't rise either. It disperses throughout the cabin, reducing visibility and contaminating the atmosphere. Fire suppression systems use water mist, foam, or gas agents, but deploying them risks damaging equipment and contaminating the environment. The crew must locate and extinguish fires quickly while wearing breathing equipment in a smoke-filled cabin. Training helps, but real emergencies are chaotic and terrifying. The cumulative cognitive decline from radiation exposure creates an insidious problem. Brain damage develops slowly. Neural circuits that process information degrade. The crew member doesn't necessarily notice their own declining performance. They feel fine, but their reaction time slows. Their problem-solving ability decreases. Their memory becomes less reliable. Other crew members might notice, but confronting someone about cognitive decline is psychologically fraught. How do you tell the engineer that you don't trust their calculations anymore? How do you remove someone from critical duties when you're already understaffed? Research suggests at least one crew member in a 5-person Mars mission will show severe cognitive deficits by return. That's not a minor impairment. That's someone who can no longer reliably perform complex tasks, who might make dangerous mistakes, who requires supervision and assistance. In a 6-person crew, you're suddenly operating with 5 functional members, one of whom needs support. Your margin for additional casualties or incapacitation just vanished. The neurological damage isn't limited to cognition. Motor control can be affected. Fine motor skills that delicate repairs require might deteriorate. Spatial reasoning that navigation and piloting demand might become impaired. Emotional regulation that maintaining crew harmony requires might break down. Someone who was patient and diplomatic might become irritable and confrontational as their prefrontal cortex sustains radiation damage. These personality changes strain relationships exactly when crew cohesion is most critical. The isolation research shows that successful Antarctic winter overcrews develop strong bonds and mutual support systems. Failed crews fracture into factions, scapegoat individuals, and experience psychological breakdowns. The difference often comes down to crew selection and preparation. But even perfectly selected crews can fail under sufficient stress. And Mars missions involve stressors far beyond Antarctic stations. There's no comparison in human experience. We're extrapolating from inadequate data. and hoping the extrapolation holds. The psychological consequences extend beyond crew dynamics. Decision-making deteriorates under chronic stress. Sleep deprivation from anxiety and noise accumulates. Judgment becomes impaired. Risk assessment breaks down. People make mistakes they wouldn't make under normal conditions. But there are no normal conditions on a Mars mission. Every decision carries weight. Every error has consequences. The medical capabilities aboard the spacecraft represent another terrifying limitation. You can't carry an MRI machine to Mars. You can't stock every medication. You can't train crew members to perform every surgical procedure. The medical officer has basic training and limited equipment. They can handle minor injuries, common illnesses, routine procedures. But what happens when someone needs an appendectomy? What if someone develops a kidney stone? What if someone breaks their spine during a landing accident? Surgical capability in microgravity presents unique challenges. Blood doesn't drain. It forms floating spheres. Surgical instruments must be specially designed. Anesthesia behaves differently. Recovery requires managing fluid shifts and preventing infection in an environment where your immune system is compromised. The medical officer performs surgery they've practiced in simulation, but never done on a real patient. The crew member on the operating table knows this is their only option. There's no evacuation, no calling for backup, no specialist consultation except delayed advice from Earth. The psychological impact of medical emergencies compounds everything. Watching a crew member suffer without adequate treatment destroys morale. Knowing you might be next creates constant anxiety. The crew member who survives a close call may develop post-traumatic stress. They become hypervigilant about symptoms. They catastrophize minor aches. They lose confidence in the mission's safety margins. Recent research into kidney function during spaceflight revealed disturbing findings. The kidneys require gravity to operate correctly. Extended microgravity exposure damages kidney structures in ways that may be permanent. A 2024 study showed that even 1 month in space can fundamentally alter kidney pathways. The damage is irreversible. On a Mars mission, kidney stones become a serious risk. The pain is excruciating. The treatment requires procedures that are extremely difficult in microgravity. If a kidney stone blocks a ureter, the crew member faces potential kidney failure without surgical intervention. The accelerated aging effect is equally concerning. Astronauts who spend 6 months on the International Space Station show arterial and endocrine damage consistent with over a decade of terrestrial aging. Their biological age increases faster than calendar time. On a 3-year Mars mission, crew members might biologically age 30 years or more. They launch in their 30s and 40s. They return with the bodies of people in their 60s and 70s. The cardiovascular damage, the cellular senescence, the accumulated DNA damage, all of this persists after return. This aging isn't just cosmetic, it's functional decline. Bone density lost in space doesn't fully recover. Muscle mass takes years to rebuild. Cardiovascular capacity remains diminished. Vision changes may be permanent. Cognitive effects can persist. The astronaut who returns from Mars might never fully recover their pre-mission capabilities. They've sacrificed decades of healthy life for this journey. The compounding nature of these hazards is what makes Mars missions so dangerous. Radiation damages your immune system. Your weakened immune system makes you vulnerable to infection. Infection triggers inflammation. Inflammation accelerates aging. Aging reduces your ability to handle stress. Stress impairs decision-making. Poor decisions lead to accidents. Accidents cause injuries. Injuries in microgravity heal slowly. Slow healing keeps you debilitated longer. And all of this happens while radiation continues damaging your tissues, while your bones continue dissolving, while your muscles continue atrophying. There's no pause button, no time out, no recovery period. The hazards are relentless. They operate continuously for 3 years. Every day in space accumulates more damage. Every week the crew becomes more vulnerable. Every month the safety margins shrink. The distance from Earth creates psychological effects beyond isolation. When you look out the window and Earth is a tiny blue dot, barely distinguishable from stars, something fundamental shifts in human consciousness. This is called the Earth out of view phenomenon. Astronauts report feelings of cosmic insignificance, existential dread, profound loneliness. The Earth has been humanity's entire context for existence. When it becomes visually negligible, when it's just another point of light, the psychological impact can be overwhelming. Communication delays make this worse. On the International Space Station, astronauts can have real-time video calls with loved ones. They can speak with psychologists immediately when they're struggling. But Mars missions face communication delays up to 44 minutes round trip. You send a message. 22 minutes later, it reaches Earth. 22 minutes after that, the response arrives. Conversations become asynchronous exchanges. Emotional support loses its immediacy. If you're having a panic attack, you wait 44 minutes for reassurance. This communication structure fundamentally changes the relationship between crew and ground control. The crew must be autonomous. They can't wait for Earth to solve problems. By the time Earth receives a distress signal and sends instructions, the situation has evolved or been resolved. The crew develops an us versus them mentality. Earth becomes distant in more than physical space. Psychologically, the crew becomes isolated, operating as a separate entity. The bandwidth limitations compound this. High-definition video requires enormous data transmission capacity. Mars missions will have limited bandwidth. Communications will be text-based or low-quality video. You can't see your child's face clearly. You can't read subtle emotional cues in your spouse's expression. The connections that sustain you become attenuated, degraded, frustrating. News from Earth arrives in time-delayed chunks. By the time you hear about events, they're old news. You're disconnected from the cultural conversation. You miss births, deaths, weddings, crises. Life continues without you. Your friends move on. Your children grow up. You become a ghost, present but not participating. The crew develops its own microculture. Inside jokes, shared experiences, a bubble of reference that excludes everyone on Earth. When you return, you can't fully explain what it was like. The gap between your experience and anyone else's comprehension becomes unbridgeable. Mars astronauts may face lifetime psychological consequences from this profound isolation. The physical environment inside the spacecraft becomes psychologically oppressive. You're living in a space roughly the size of a studio apartment with 5 other people for 3 years. There's no privacy. Every sound is audible. Every smell is shared. You can't go for a walk. You can't visit a different location. The scenery never changes. The walls close in. Personal space becomes a source of conflict. Someone's sleeping area encroaches on someone else's storage. Someone's exercise time conflicts with someone's work schedule. The galley can only accommodate 2 people comfortably. The toilet has a line. Every square centimetre of living space is negotiated, contested, defended. Territory disputes that would seem trivial on Earth become flashpoints for serious conflict. Sleep disruption is inevitable. The spacecraft is never quiet. Pumps run constantly. Fans circulate air. Equipment beeps and hums. Other crew members move around on different schedules. You wear earplugs and eye masks, but sleep quality suffers. Chronic partial sleep deprivation accumulates. Your cognitive function declines. Your emotional regulation weakens. Your patience frays. The food situation degrades morale more than people anticipate. You're eating preserved packaged food for 3 years. No fresh vegetables, no fresh fruit, no variety beyond what was loaded before launch. The same meals rotate endlessly. Food becomes joyless fuel. Eating is a reminder of what you're missing rather than a pleasure. Psychological research from Antarctic stations and submarine deployments provides some data about isolation effects, but Mars missions exceed these analogues in duration and severity. Antarctic winter overcrews can be resupplied. Submarine crews eventually surface. Mars crews have no resupply, no escape, no reprieve. The research suggests that successful isolated crews share certain characteristics: strong initial screening, extensive training, clear role definitions, effective conflict resolution mechanisms. But even perfect selection and preparation can't guarantee success under Mars mission conditions. The third quarter phenomenon is well documented in isolation research. Roughly 3/4 through a deployment, morale crashes. The initial excitement has faded. The end is still distant. This is when psychological breakdowns occur, when conflicts escalate, when people give up. On a Mars mission, the third quarter arrives roughly 2 years in. You're exhausted, you're damaged, you're isolated, and you still have a year to go. Some crew members will develop clinical depression. Others will develop anxiety disorders. Some will experience dissociative episodes. Some will have psychotic breaks. The crew's medical officer must manage psychiatric emergencies with limited medication and no specialist training. They might need to sedate and restrain a violent crew member. They might need to talk someone through suicidal ideation. They're operating far outside their expertise. The impact on mission success is obvious. A psychologically fractured crew makes poor decisions. They take unnecessary risks or become paralyzed by fear. They stop communicating effectively. They sabotage each other subtly or overtly. The mission can fail not from technical problems, but from human breakdown. The cardiovascular deconditioning from microgravity creates another insidious problem. Your heart doesn't need to work as hard in weightlessness. It becomes smaller. Your blood vessels lose tone. Your blood volume decreases. This is fine in microgravity, but when you arrive at Mars with its 38% Earth gravity, you need to function. You need to climb out of the lander. You need to set up habitats. You need to perform physically demanding work. Instead, you experience orthostatic intolerance. When you stand, blood pools in your legs. Your brain doesn't get enough oxygen. You become dizzy. You might faint. Your heart races trying to maintain blood pressure. You're weak and unsteady. This is after 9 months of inactivity. Your muscles have atrophied. Your bones are fragile. And now you're expected to do heavy construction work in a spacesuit. The exercise equipment aboard the spacecraft helps, but can't fully prevent deconditioning. You exercise 2 hours daily against resistance bands and treadmills, but it's not enough. The body needs the constant micro-stresses of living in gravity, muscles that stabilize your posture, bones that bear your weight, cardiovascular systems that fight gravity to circulate blood. Without these constant demands, deterioration is inevitable. Landing on Mars after 9 months in microgravity is physically traumatic. The crew experiences partial gravity for the first time in months. Everything feels heavy. Moving is exhausting. They're disoriented and nauseated from vestibular system disruption, and they must immediately transition to surface operations. There's no recovery period, no gradual reacclimation. They land and start working. The Mars surface presents its own hazards. The atmosphere is 95% carbon dioxide. The pressure is less than 1% of Earth's. The temperature averages -80 degrees Fahrenheit. Dust storms can last months and cover the entire planet. The soil contains perchlorates, toxic chemicals that damage thyroid function and pose cancer risks. Simply walking on Mars exposes you to these compounds. Spacesuits become your survival bubble. Every excursion outside the habitat requires suiting up. The suits are bulky and restrictive. They limit your range of motion. They're physically exhausting to work in. Gloves reduce your manual dexterity. You can't feel what you're touching. You can't grip tools properly. Everything takes 3 times as long and requires 3 times as much effort. Suit failures can be lethal. A tear in the fabric, a seal malfunction, an oxygen supply problem. You might have minutes to reach safety. The buddy system helps, but isn't foolproof. If you're working alone and your suit fails, you die. There's no rescue. The other crew members might not reach you in time. The dust is particularly insidious. Mars dust is extremely fine. It's electrostatically charged. It sticks to everything. It gets into seals and mechanisms. It's abrasive and damages equipment. Worse, it's toxic. Breathing Mars dust causes lung damage. The particles are sharp and irregular. They trigger inflammation. Long-term exposure risks cancer and pulmonary disease. Keeping dust out of the habitat is nearly impossible. Every time someone enters through the airlock, they bring dust with them. It accumulates. It contaminates surfaces. The crew breathes it. They ingest it with food. It's an unavoidable source of chronic exposure. The psychological consequences extend beyond crew dynamics. Decision-making deteriorates under chronic stress. Sleep deprivation from anxiety and noise accumulates. Judgment becomes impaired. Risk assessment breaks down. People make mistakes they wouldn't make under normal conditions. But there are no normal conditions on a Mars mission. Every decision carries weight. Every error has consequences. The medical capabilities aboard the spacecraft represent another terrifying limitation. You can't carry an MRI machine to Mars. You can't stock every medication. You can't train crew members to perform every surgical procedure. The medical officer has basic training and limited equipment. They can handle minor injuries, common illnesses, routine procedures. But what happens when someone needs an appendectomy? What if someone develops a kidney stone? What if someone breaks their spine during a landing accident? Surgical capability in microgravity presents unique challenges. Blood doesn't drain. It forms floating spheres. Surgical instruments must be specially designed. Anesthesia behaves differently. Recovery requires managing fluid shifts and preventing infection in an environment where your immune system is compromised. The medical officer performs surgery they've practiced in simulation, but never done on a real patient. The crew member on the operating table knows this is their only option. There's no evacuation, no calling for backup, no specialist consultation except delayed advice from Earth. The psychological impact of medical emergencies compounds everything. Watching a crew member suffer without adequate treatment destroys morale. Knowing you might be next creates constant anxiety. The crew member who survives a close call may develop post-traumatic stress. They become hypervigilant about symptoms. They catastrophize minor aches. They lose confidence in the mission's safety margins. Recent research into kidney function during spaceflight revealed disturbing findings. The kidneys require gravity to operate correctly. Extended microgravity exposure damages kidney structures in ways that may be permanent. A 2024 study showed that even 1 month in space can fundamentally alter kidney pathways. The damage is irreversible. On a Mars mission, kidney stones become a serious risk. The pain is excruciating. The treatment requires procedures that are extremely difficult in microgravity. If a kidney stone blocks a ureter, the crew member faces potential kidney failure without surgical intervention. The accelerated aging effect is equally concerning. Astronauts who spend 6 months on the International Space Station show arterial and endocrine damage consistent with over a decade of terrestrial aging. Their biological age increases faster than calendar time. On a 3-year Mars mission, crew members might biologically age 30 years or more. They launch in their 30s and 40s. They return with the bodies of people in their 60s and 70s. The cardiovascular damage, the cellular senescence, the accumulated DNA damage, all of this persists after return. This aging isn't just cosmetic, it's functional decline. Bone density lost in space doesn't fully recover. Muscle mass takes years to rebuild. Cardiovascular capacity remains diminished. Vision changes may be permanent. Cognitive effects can persist. The astronaut who returns from Mars might never fully recover their pre-mission capabilities. They've sacrificed decades of healthy life for this journey. The compounding nature of these hazards is what makes Mars missions so dangerous. Radiation damages your immune system. Your weakened immune system makes you vulnerable to infection. Infection triggers inflammation. Inflammation accelerates aging. Aging reduces your ability to handle stress. Stress impairs decision-making. Poor decisions lead to accidents. Accidents cause injuries. Injuries in microgravity heal slowly. Slow healing keeps you debilitated longer. And all of this happens while radiation continues damaging your tissues, while your bones continue dissolving, while your muscles continue atrophying. There's no pause button, no timeout, no recovery period. The hazards are relentless. They operate continuously for 3 years. Every day in space accumulates more damage. Every week the crew becomes more vulnerable. Every month the safety margins shrink. The distance from Earth creates psychological effects beyond isolation. When you look out the window and Earth is a tiny blue dot, barely distinguishable from stars, something fundamental shifts in human consciousness. This is called the Earth out of view phenomenon. Astronauts report feelings of cosmic insignificance, existential dread, profound loneliness. The Earth has been humanity's entire context for existence. When it becomes visually negligible, when it's just another point of light, the psychological impact can be overwhelming. Communication delays make this worse. On the International Space Station, astronauts can have real-time video calls with loved ones. They can speak with psychologists immediately when they're struggling. But Mars missions face communication delays up to 44 minutes round trip. You send a message. 22 minutes later, it reaches Earth. 22 minutes after that, the response arrives. Conversations become asynchronous exchanges. Emotional support loses its immediacy. If you're having a panic attack, you wait 44 minutes for reassurance. The communication structure fundamentally changes the relationship between crew and ground control. The crew must be autonomous. They can't wait for Earth to solve problems. By the time Earth receives a distress signal and sends instructions, the situation has evolved or been resolved. The crew develops an us versus them mentality. Earth becomes distant in more than physical space. Psychologically, the crew becomes isolated, operating as a separate entity. The bandwidth limitations compound this. High-definition video requires enormous data transmission capacity. Mars missions will have limited bandwidth. Communications will be text-based or low-quality video. You can't see your child's face clearly. You can't read subtle emotional cues in your spouse's expression. The connections that sustain you become attenuated, degraded, frustrating. News from Earth arrives in time-delayed chunks. By the time you hear about events, they're old news. You're disconnected from the cultural conversation. You miss births, deaths, weddings, crises. Life continues without you. Your friends move on. Your children grow up. You become a ghost, present but not participating. The crew develops its own microculture, inside jokes, shared experiences, a bubble of reference that excludes everyone on Earth. When you return, you can't fully explain what it was like. The gap between your experience and anyone else's comprehension becomes unbridgeable. Mars astronauts may face lifetime psychological consequences from this profound isolation. The physical environment inside the spacecraft becomes psychologically oppressive. You're living in a space roughly the size of a studio apartment with 5 other people for 3 years. There's no privacy. Every sound is audible. Every smell is shared. You can't go for a walk. You can't visit a different location. The scenery never changes. The walls close in. Personal space becomes a source of conflict. Someone's sleeping area encroaches on someone else's storage. Someone's exercise time conflicts with someone's work schedule. The galley can only accommodate 2 people comfortably. The toilet has a line. Every square centimetre of living space is negotiated, contested, defended. Territory disputes that would seem trivial on Earth become flashpoints for serious conflict. Sleep disruption is inevitable. The spacecraft is never quiet. Pumps run constantly. Fans circulate air. Equipment beeps and hums. Other crew members move around on different schedules. You wear earplugs and eye masks, but sleep quality suffers. Chronic partial sleep deprivation accumulates. Your cognitive function declines. Your emotional regulation weakens. Your patience frays. The food situation degrades morale more than people anticipate. You're eating preserved packaged food for 3 years. No fresh vegetables, no fresh fruit, no variety beyond what was loaded before launch. The same meals rotate endlessly. Food becomes joyless fuel. Eating is a reminder of what you're missing rather than a pleasure. Psychological research from Antarctic stations and submarine deployments provides some data about isolation effects. But Mars missions exceed these analogues in duration and severity. Antarctic winter overcrews can be resupplied. Submarine crews eventually surface. Mars crews have no resupply, no escape, no reprieve. The research suggests that successful isolated crews share certain characteristics: strong initial screening, extensive training, clear role definitions, effective conflict resolution mechanisms. But even perfect selection and preparation can't guarantee success under Mars mission conditions. The third quarter phenomenon is well documented in isolation research. Roughly 3/4 through a deployment, morale crashes. The initial excitement has faded. The end is still distant. This is when psychological breakdowns occur, when conflicts escalate, when people give up. On a Mars mission, the third quarter arrives roughly 2 years in. You're exhausted, you're damaged, you're isolated, and you still have a year to go. Some crew members will develop clinical depression, others will develop anxiety disorders, some will experience dissociative episodes, some will have psychotic breaks. The crew's medical officer must manage psychiatric emergencies with limited medication and no specialist training. They might need to sedate and restrain a violent crew member. They might need to talk someone through suicidal ideation. They're operating far outside their expertise. The impact on mission success is obvious. A psychologically fractured crew makes poor decisions. They take unnecessary risks or become paralyzed by fear. They stop communicating effectively. They sabotage each other subtly or overtly. The mission can fail not from technical problems, but from human breakdown. The cardiovascular deconditioning from microgravity creates another insidious problem. Your heart doesn't need to work as hard in weightlessness. It becomes smaller. Your blood vessels lose tone. Your blood volume decreases. This is fine in microgravity. But when you arrive at Mars with its 38% Earth gravity, you need to function. You need to climb out of the lander. You need to set up habitats. You need to perform physically demanding work. Instead, you experience orthostatic intolerance. When you stand, blood pools in your legs. Your brain doesn't get enough oxygen. You become dizzy. You might faint. Your heart races trying to maintain blood pressure. You're weak and unsteady. This is after 9 months of inactivity. Your muscles have atrophied. Your bones are fragile. And now you're expected to do heavy construction work in a spacesuit. The exercise equipment aboard the spacecraft helps, but can't fully prevent deconditioning. You exercise 2 hours daily against resistance bands and treadmills. But it's not enough. The body needs the constant micro-stresses of living in gravity. Muscles that stabilize your posture, bones that bear your weight, cardiovascular systems that fight gravity to circulate blood. Without these constant demands, deterioration is inevitable. Landing on Mars after 9 months in microgravity is physically traumatic. The crew experiences partial gravity for the first time in months. Everything feels heavy. Moving is exhausting. They're disoriented and nauseated from vestibular system disruption, and they must immediately transition to surface operations. There's no recovery period, no gradual reacclimation. They land and start working. The Mars surface presents its own hazards. The atmosphere is 95% carbon dioxide. The pressure is less than 1% of Earth's. The temperature averages -80 degrees Fahrenheit. Dust storms can last months and cover the entire planet. The soil contains perchlorates, toxic chemicals that damage thyroid function and pose cancer risks. Simply walking on Mars exposes you to these compounds. Spacesuits become your survival bubble. Every excursion outside the habitat requires suiting up. The suits are bulky and restrictive. They limit your range of motion. They're physically exhausting to work in. Gloves reduce your manual dexterity. You can't feel what you're touching. You can't grip tools properly. Everything takes 3 times as long and requires 3 times as much effort. Suit failures can be lethal. A tear in the fabric, a seal malfunction, an oxygen supply problem. You might have minutes to reach safety. The buddy system helps, but isn't foolproof. If you're working alone and your suit fails, you die. There's no rescue. The other crew members might not reach you in time. The dust is particularly insidious. Mars dust is extremely fine. It's electrostatically charged. It sticks to everything. It gets into seals and mechanisms. It's abrasive and damages equipment. Worse, it's toxic. Breathing Mars dust causes lung damage. The particles are sharp and irregular. They trigger inflammation. Long-term exposure risks cancer and pulmonary disease. Keeping dust out of the habitat is nearly impossible. Every time someone enters through the airlock, they bring dust with them. It accumulates. It contaminates surfaces. The crew breathes it. They ingest it with food. It's an unavoidable source of chronic exposure. The habitat itself poses constant danger. It's a pressurized bubble surrounded by vacuum. A single puncture means rapid decompression. Equipment failures kill you. Life support systems must function perfectly. The oxygen generators can't fail. The carbon dioxide scrubbers must work continuously. Water recycling systems need to operate without interruption. Any malfunction starts a countdown to death. You're completely dependent on technology. There's no backup Earth, no emergency services, no rescue mission. If something breaks that you can't fix, you die. The crew carries spare parts and repair materials, but you can't bring everything. Some failures are irreparable. Some problems have no solution with available resources. Medical emergencies on Mars are nightmares. There's no hospital, no specialists, no advanced diagnostic equipment. The crew includes someone with medical training, but they're not surgeons. They're not equipped for major trauma. Appendicitis could be fatal. A broken bone might not heal properly. Infections can spiral out of control. The psychological environment deteriorates over time. You're living in close quarters with the same people for 3 years. There's no privacy, no escape from interpersonal conflicts. Small annoyances become major grievances. Personality clashes intensify. The isolation is absolute. Communication with Earth operates on significant delays. When you send a message home, the response takes up to 44 minutes round trip. You can't have conversations. You can't get immediate advice. You watch video messages from family knowing they were recorded 22 minutes ago. By the time they receive your reply, another 22 minutes have passed. The disconnect is psychologically devastating. Earth itself becomes abstract. You watch it shrink to a blue dot. Then it disappears among the stars. You're farther from home than any human has ever been. The distance is incomprehensible. 140 million miles of emptiness. No one can reach you. You can't go back. You're committed to the full mission duration. The sensory deprivation is profound. Mars offers limited variety. The landscape is rust-colored rocks and dust. The sky is butterscotch during the day, pink at sunset. There are no forests, no oceans, no weather beyond dust storms, no life. Nothing grows. Nothing moves except your crew and equipment. You miss Earth's sensory richness. the smell of rain, the sound of wind through trees, the feel of grass, the sight of clouds, colors beyond red and brown. The absence of these experiences creates psychological hunger. Your brain craves stimulation it can't receive. Sleep becomes problematic. The Martian day is 24 hours and 39 minutes. Your circadian rhythm struggles with this shift. The habitat lighting tries to simulate day-night cycles, but it's not the same as natural sunlight. Sleep quality degrades. You experience chronic fatigue. Cognitive performance suffers. The workload is relentless. Every day demands physical labor, equipment maintenance, habitat repairs, scientific experiments, sample collection, data recording. There are no days off, no vacations. The mission objectives don't pause. You're constantly working while physically compromised and psychologically stressed. Relationships within the crew face extreme pressure. You depend on each other for survival, but you also irritate each other constantly. Small habits become infuriating. The way someone chews, their laugh, how they organize shared spaces. These trivial things grow into major sources of tension when there's no escape. Conflict resolution is critical but difficult. There's no authority figure who can separate feuding crew members. No way to send someone home. Everyone must continue working together. Grudges and resentments accumulate. The social dynamics can poison the entire mission. The return journey presents its own horrors. After 18 months on Mars, you face another 9 months in microgravity. Your body has partially adapted to Martian gravity. Now you lose even that. The deconditioning accelerates. Your muscles atrophy further. Your bones become even more fragile. The radiation exposure continues accumulating. You've already absorbed dangerous doses during the outbound journey and Mars surface stay. The return trip adds another massive exposure. By journey's end, you've received radiation equivalent to thousands of chest X-rays. The cancer risk is enormous. The neurological damage is potentially severe. The spacecraft feels smaller on the return. You've been confined for over 2 years. The novelty is gone. The excitement has faded. You're just enduring, counting days, waiting for it to end. The monotony is crushing. Food becomes a major psychological issue. You're eating the same preserved meals repeatedly. The variety is extremely limited. Fresh food is impossible. Everything is freeze-dried, irradiated, or vacuum-packed. The textures are wrong. The flavors are muted. Eating becomes a joyless necessity rather than pleasure. Hygiene is challenging and unpleasant. Water is too precious for regular showers. You use wet wipes and dry shampoo. You smell. Everyone smells. The habitat develops a persistent odor of human bodies and recycled air. It's inescapable and nauseating. The isolation intensifies psychological problems. If you develop depression or anxiety, there's minimal treatment available. The crew might have some psychiatric medications, but there's no therapist, no counseling. You can send messages to Earth-based psychiatrists, but the communication delay makes real-time therapy impossible. Some crew members might experience acute psychological crises, panic attacks, severe depression, even psychotic episodes. The confined environment amplifies these problems. There's nowhere to decompress. No way to escape triggering situations. The affected person must continue functioning. The crew must manage the situation with limited resources. Sleep deprivation accumulates over the mission. Chronic fatigue becomes the baseline state. This impairs judgment. It slows reaction times. It makes you irritable and emotionally unstable. Critical decisions get made by exhausted people. Mistakes become more likely. Equipment begins failing as the mission progresses. Components wear out, seals degrade, electronics malfunction. The repair burden increases. More of your time goes to maintenance, less to productive work. The habitat becomes less reliable. Systems you depend on become untrustworthy. The journey back to Earth doesn't end the ordeal. Re-entry through Earth's atmosphere is violent and dangerous. The spacecraft must hit a precise angle. Too steep and you burn up. Too shallow and you skip off the atmosphere into space. The G-forces during re-entry are brutal on your weakened body. Landing subjects you to full Earth gravity after nearly 3 years of reduced gravity. Your body has completely deconditioned. Standing is excruciating. Your muscles can barely support your weight. Your bones might fracture from the stress. You can't walk. You possibly can't even sit upright without support. The medical team waits at the landing site. You're immediately placed on stretchers. Your body is broken. You need months of rehabilitation, physical therapy, bone density treatment, cardiovascular reconditioning. Some damage might be permanent. Some functions might never fully recover. The radiation exposure consequences unfold over years. Cancer doesn't appear immediately. It develops slowly. Cells with damaged DNA multiply. Tumors form. You might develop leukemia, lung cancer, colon cancer, brain tumors. The latency period is unpredictable. You live with constant medical monitoring, regular screenings, watching for malignancies. Neurological damage reveals itself gradually. Cognitive problems worsen. Memory becomes unreliable. You struggle with concentration. Decision-making is impaired. You might develop early-onset dementia. The brain damage from cosmic ray exposure is irreversible. Neural circuits that were destroyed don't regenerate. Your vision problems might persist or worsen. The optic nerve damage from spaceflight-associated neuroocular syndrome can be permanent. You might need corrective lenses. You might experience blind spots. In severe cases, you could face significant vision loss. The cardiovascular damage accelerates your biological aging. Your heart and blood vessels have aged decades during the mission. You face elevated risks of heart disease, stroke, atherosclerosis. Your cardiovascular age might be 20 or 30 years beyond your chronological age. The kidney damage might progress to kidney disease. Your renal function has been permanently impaired. You might eventually need dialysis. In the worst case, kidney transplant. The toxic compounds you were exposed to on Mars continue affecting your organs years later. Your immune system remains compromised. You're more susceptible to infections. Your body struggles to fight off diseases. Latent viruses that reactivated during the mission might cause chronic problems. You experience more frequent illnesses. Recovery takes longer. The psychological scars persist. You might develop post-traumatic stress disorder, anxiety disorders, depression. The extreme isolation and constant danger have left marks on your psyche. You have trouble readjusting to normal life. Earth feels strange and overwhelming. Crowds are intolerable. You can't handle the sensory stimulation. Your relationships with family and friends have been strained by 3 years of minimal contact. They've moved on with their lives. You've changed fundamentally. The shared experiences that connected you are gone. You have nothing in common with people who haven't endured what you have. You feel isolated, even among crowds. Other crew members understand, But those relationships are complicated. You've been through trauma together, but you've also been sources of stress for each other. Some crew relationships strengthen, others fracture completely. The shared experience doesn't guarantee lasting bonds. Your career options are limited. You're medically compromised. You can't work in demanding physical environments. Your cognitive impairments affect your professional capabilities. The radiation exposure might disqualify you from future space flights. Your most significant achievement might also be your last. Financial compensation doesn't erase the costs. You've traded years of your life and permanent health damage for the mission. The salary and benefits seem inadequate. No amount of money restores your body. Nothing compensates for the experiences you missed on Earth. The time with family, the career opportunities, the simple pleasures of normal life. You question whether it was worth it. The scientific discoveries feel abstract compared to your suffering. The advancement of human knowledge doesn't heal your damaged organs. The inspiration you provided to others doesn't restore your cognitive function. You paid an enormous personal price for humanity's expansion into space. The next generation of Mars explorers will benefit from your experience. Mission planners learn from your medical data. Engineers improve spacecraft based on equipment failures you documented. Psychologists develop better crew selection and support protocols. Your sacrifice advances the program, but you personally bear the consequences. This is the reality of deep space survival. It's not the adventure portrayed in science fiction. It's a grinding ordeal of physical deterioration, psychological stress, constant danger, and permanent health consequences. The human body wasn't designed for this environment. We're forcing it into conditions it can't truly withstand. We're asking people to sacrifice their health, their futures, possibly their lives, to push humanity's boundaries outward. The question isn't whether we can survive deep space. We can, technically, for limited periods. The question is what we're willing to sacrifice, what permanent damage we'll accept, what risks we'll take. Because survival isn't the same as thriving. Making it back alive isn't the same as coming home whole. Every deep space mission is a calculated gamble with human lives. We're betting that the benefits outweigh the costs, that the knowledge gained justifies the damage done, that pushing humanity into the cosmos is worth the price individuals pay. Whether that calculation is correct depends on values that go beyond science. It depends on what we believe humanity's future should be and what we're willing to endure to reach it. The engineers know these problems. NASA's researchers document every physiological breakdown. Medical teams track the damage with clinical precision. And still, we're planning to send people to Mars. Not because we've solved these problems, but because we've decided the mission matters more than the solutions. This creates an uncomfortable truth that nobody wants to say directly. The first Mars mission might be a one-way trip, not by design, but by consequence. The crew might make it to Mars. They might even make it back to Earth. But the people who return won't be the same people who left. Not psychologically, not biologically. They'll be fundamentally altered by an environment that systematically dismantled their bodies, cell by cell, over 3 years. We talk about Mars colonization like it's inevitable, like we're just working out the engineering details. But the engineering problems might be the easy part. Building better radiation shielding is a solvable problem. Designing more efficient life support systems is achievable. What's not solvable is the fundamental incompatibility between human biology and deep space. Evolution spent billions of years optimizing us for Earth, gravity, atmosphere, magnetic field protection, abundant water, breathable air. Every system in your body assumes these conditions. Your bones expect to bear weight. Your immune system expects gravity to help distribute lymph fluid. Your cardiovascular system expects to pump blood upward against gravity's pull. Your brain expects regular day-night cycles and protection from cosmic radiation. Deep space provides none of this. It's not just hostile to human life. It's the absence of conditions that make human life possible. We're not adapting to a harsh environment. We're trying to survive in fundamentally unsuitable conditions while our bodies progressively fail. The technology helps. Spacesuits create temporary bubbles of Earth-like conditions. Habitats provide pressurized environments with breathable air. Life support systems recycle water and generate oxygen. But these are artificial interventions fighting against the natural state of deep space. They require constant energy, maintenance, and vigilance. Any failure means immediate death, and they can't protect against everything. They can't shield you from galactic cosmic radiation. They can't prevent bone loss in microgravity. They can't stop your immune system from collapsing. They can't preserve your cognitive function as radiation damages your brain. Technology extends survival but doesn't eliminate the fundamental hazards. Some researchers argue we need biological modifications, genetic engineering to make humans more radiation resistant, pharmaceutical interventions to prevent bone loss, augmented immune systems, designer microbiomes optimized for space environments. These solutions exist only in theory. The ethical implications are staggering. We'd be creating a new category of humans specifically engineered for space. Would these modified humans still be fully human? Could they return to Earth and function normally? Would they be accepted by society or treated as other? The questions multiply faster than the answers. And even if we solve the ethical problems, the technology is decades away from practical application. So we're left with unmodified humans facing an environment that's trying to kill them. The only question is how much damage we're willing to accept. What level of permanent health impairment is acceptable for Mars explorers? How many years of biological aging? What probability of cancer? What degree of cognitive decline? NASA has career radiation exposure limits. But those limits were established for low Earth orbit missions with partial protection from Earth's magnetic field. Deep space missions exceed those limits. The agency knows this. The astronauts will know this. And the missions will proceed anyway, because we've collectively decided that reaching Mars justifies the health consequences. This shifts the ethical calculation dramatically. We're not asking whether Mars exploration is safe. We're asking whether it's worth doing, despite knowing it's unsafe. Whether the advancement of human knowledge and presence in space justifies intentionally harming the people who go there. The astronauts themselves will consent to these risks. They'll sign waivers acknowledging the health consequences. They'll undergo extensive training and preparation. There'll be volunteers who understand what they're accepting. But informed consent becomes complicated when the full extent of the risks can't be known because we've never tested them at this scale and duration. We can model the radiation exposure, we can predict bone loss rates, we can estimate cardiovascular deconditioning, but these are educated guesses based on incomplete data. the actual health outcomes might be better or worse than predicted. We won't know until after the first missions return and we examine the crew's long-term health. This makes early Mars explorers medical test subjects in addition to being astronauts. Their health data will inform future missions. Their experiences will shape improved protocols. Their sacrifices will benefit later crews, but they personally bear unknown risks that can't be fully disclosed because we don't fully understand them. The military has experience with this ethical territory. Soldiers accept risks that exceed civilian norms. They volunteer for dangerous missions, knowing they might not return. Society honors their sacrifice while acknowledging the tragedy of their deaths. Space exploration adopts similar logic. Astronauts are pioneers whose risks advance humanity's reach into the cosmos. But there's a difference. Military casualties typically result from enemy action or accident. Mars mission health damage is guaranteed. We're not sending people into an environment where they might get hurt. We're sending them into conditions that will definitely harm them. The only uncertainty is the severity. Some damage might be manageable. Moderate bone loss that recovers with extended rehabilitation. Vision changes that stabilize after return. Increased cancer risk that doesn't manifest for decades. These consequences might be acceptable to individuals who value the mission above their personal health. Other damage is catastrophic. Severe cognitive decline that permanently impairs function. Kidney failure requiring dialysis or transplant. Cardiovascular disease that dramatically shortens lifespan. Cancer that develops within years of return. These outcomes transform heroic exploration into tragedy. We don't know which scenario will occur. The range of possible outcomes spans from manageable to catastrophic. And we're proceeding despite this uncertainty because we've decided Mars exploration matters enough to find out. Perhaps that's the real reason deep space survival is so difficult. Not because the technical challenges are insurmountable, but because the human cost forces us to confront uncomfortable questions about what we value and what we're willing to sacrifice. The physics and biology are harsh but predictable. The ethics are far more complex. Deep space doesn't care about human values. It doesn't distinguish between heroism and hubris. It simply exposes biological systems to conditions they can't withstand. The radiation keeps coming. The bone loss continues. The isolation persists. These aren't moral judgments. They're physical realities. What we do with those realities reveals who we are as a species. Do we accept the human cost of space exploration? Do we modify our biology to better suit these environments? Do we develop technology that better protects fragile human bodies? Do we send robots instead and keep humans safely on Earth? There's no objectively correct answer. Different people weigh the costs and benefits differently. Some see Mars exploration as humanity's destiny worth any sacrifice. Others see it as unnecessary risk to human life. Most fall somewhere between these extremes, acknowledging both the value and the cost. The astronauts who eventually go to Mars will make their own calculations. They'll know the risks better than anyone. They'll understand what they're trading for the opportunity to walk on another planet. Their consent matters more than external judgments about whether the mission is worthwhile, but their consent doesn't change the physical reality. It doesn't reduce the radiation exposure or prevent the bone loss. It doesn't make deep space less hostile to human biology. It simply means someone chose to face those hazards anyway. This is what makes deep space survival fundamentally different from any other extreme environment on Earth. Antarctic explorers face harsh conditions, but can be evacuated in emergencies. Deep-sea divers work in hostile environments, but return to the surface after hours. High-altitude mountaineers climb in thin air, but descend to breathable atmosphere. All of these involve temporary exposure to extreme conditions with escape options. Deep space offers no escape. You can't leave when it gets too hard. You can't evacuate if things go wrong. You're committed for the full mission duration regardless of what happens to your body or mind. The exposure is continuous, cumulative, and inescapable. That's the essential truth that no technology can change. Human bodies evolved for Earth. Deep space is not Earth. The gap between these realities is enormous. We can bridge it temporarily with massive technological intervention and enormous resource expenditure, but we can't eliminate it. So when we ask whether humans can survive deep space, the answer is yes. But yes, humans can technically survive for limited periods, but they'll be damaged by the experience. But they'll face permanent health consequences. But they might not fully recover. But we don't know all the risks. But the cost is enormous. The real question isn't about survival. It's about whether the damage is acceptable. And that's not a question science can answer. That's a question about values, about priorities, about what we believe humanity's future should be. The biology and physics are clear. The ethics are where we're still working things out.